Hi there, warm welcome to our special series of Niva Bupa presents Times Network Living Room Conclave, India Health Mission Season 3, co-presented by Sensodyne. Well, our health mission is a series of episodes that intend to inform, to make people aware and educate our national audiences on the key issues that can safeguard and protect lives, featuring a discourse between leaders from the government and private sectors. I'd like to start by asking a question about what kind of an ideal daily routine one should be following for a healthy, balanced day. Well, morning walk, yoga perhaps, good food, work, maybe even going to the gym, having at least 3 liters of water. And if you feel exhausted, then definitely take a break and go on a vacation. But did anyone notice that in this process of taking care of mental and physical well-being, we forgot about taking care of one thing, which is oral health? In fact, let me tell you, when was the last time that you took notice or any action of that short, sharp sensation in your teeth while having chilled ice cream? Maybe while brushing, you might have encountered blood in your gums, but just shrugged it off, saying that you may have brushed too hard. Aren't these conversations part of our everyday lifestyle that we casually slide along with? Well, all of these very common everyday events have been signs of depleting oral health. But why is it important to take oral health so seriously? That is going to be the topic of today's episode of Living Room Conclave, India Health Mission. Be sensitive to oral health. As World Dentist Day is around the corner, we are going to start with the conversation early with this special episode where we look at why oral health is so important in maintaining overall health, the challenges that individuals face in accessing these dental facilities, and even the important role that our dentist has played in helping us maintain our oral hygiene. Let me introduce to you our esteemed panelists who will be helping us understand these subjects a bit better. Anurita Chopra joins us, the Chief Marketing Officer of Helion India Subcontinent. Brigadier Dr. Anil Kohli is also here with us, Padma Bhushan, Padma Shri Awardee, B.C. Roy Awardee, as well as the former President of Dental Council of India. Dr. Tulika Tripathi is also here on the show. She is the Director as well as the Principal of Maulana Azad Institute of Dental Sciences. Professor Dr. Afsha Laheji, the President of Indian Dental Association Mumbai, as well as the Chairperson of Women Dental Council. I'm going to come to you first, Dr. Kohli. Why would you say that keeping dental health is as vital as preserving physical health, and what role does a dentist or an orthodontist plays in helping you analyze your overall well-being as well?
Now, oral health, if you look into it, doesn't mean only eating. What your speech is being affected by the oral health. Your breathing is being affected by the oral health. The mouth is the gateway to the human body. There are many diseases which can be diagnosed by looking in the oral cavity. Precancerous conditions are there, eating habits are there, nutritional things are there. India being the youngest nation in the world, where we have more than 40% of the younger generation, and our average age has raised from 37 years at 47 is 63 years of age. For that you need a healthy teeth, good teeth. Coming to the point why it is important to talk about the oral health, because there are many diseases which can be diagnosed by looking into the oral cavity. You must have heard from the oral cavity, from the gum disease as you raise right now, bleeding gums and all, you can have the bacteremia. It goes to the heart. You can have the respiratory problem, pneumonia. Diabetes is one of the common conditions. Then kidney problems. There are many things which can be diagnosed and can be worked out and can be saved. More than that, in oral cancer is one of the highest rates in this country. Now, orthodontist is the one we know who sets the crooked teeth all right. No, but it doesn't only sets the alignment of the teeth, it makes your aesthetics better, it makes you more comfortable in eating, your occlusion. Today in a stressful life you feel a lot of TMJ problems where you clench the teeth and there's a bruxism. All these things can be treated and can be looked after by the dentist, and more than that, in the society, which is very not well aware, people are aware, in every hour, 3 children are born with a cleft palate, which is a very high number. And there is a big problem for a child, especially the girl child, if he is born with a cut lip. And she has to live a long life, and to bring her to the normal, if the treatment is done at the early stage, and she can live a normal life, and she can be a good citizen for the India.
Well, absolutely. Couldn't agree with you more. In that case, let me take the next question across to Anurita Chopra. Well, it seems that more than 70% of the school-aged children have dental caries. In fact, more than 90% of the adults have periodontal disease as well. Some of things that Dr. Joshi has also pointed out. So according to you, Anurita, what are the key reasons that we as a nation lack focus towards oral health in India despite this?
Well, thanks, Meghna, for your question. And it's great to be here on a platform sharing with dignitaries and talking about this important mission, which is oral health. I think I could just break my answer into three topics, which is first, there is very limited awareness of what oral health really is all about. The fact that it can have a lasting impact on not just your oral health, but the rest of your body as well. People just don't know. And it is very stark, but say for 10,000 people in India, there are about 2 dentists. So that says it all, because people don't care this much about their oral health. They feel that it's important to take care of other diseases. You know, there are cardiovascular diseases, there are respiratory diseases, diabetes. These are interruptive diseases, and so people, are more bothered about these kind of diseases. They will go to doctors regularly, take medication regularly, but somehow oral health gets taken for granted in one way. And what is telling also is the fact that, if you look at the number of doctors versus number of dentists, 1/4 is the number of dentists compared to the number of doctors in India. That says it all again. And yet, when you look at data and you see that, say, WHO has released an oral health status survey in 22, and it says more than 80% of Indians will have oral health conditions, and therefore, literally, 8 out of 10 people will go through some or the other form of oral health condition. It may not be communicable, but it is debilitating because it will impact other things in your life. It will have definitely an impact on other conditions as well, including the kind of nutrition that you take inside your body. So, we just heard that oral health is the gateway to good health. Absolutely. It's just that people don't feel that it is serious enough to do anything about. They don't know that it will get worse. And we know that only 5% of India visits dentists. It is when you're in this entirely bad condition, your tooth is aching, when you know that you have to go for a root canal or for extraction, when it's really reached that position, how many people do you know who go for regular oral health checkups? They don't. So clearly it starts from this entire piece about education, about driving in awareness, about driving seriousness. And that is why we partner very, very strongly with dentists across the country, with government bodies, because our job, our mission, and we take this very, very seriously, is to first and foremost raise awareness about the condition, about making people aware that they should be going for regular dental checkups, about making people understand the gravity of why, if ignored, what it could lead to. And actually, on days like this, for example, World Oral Health Day, which happened in March, or 3rd October, we have World Dentist Day. Here is where we come together. We drove some 80,000 dental checkups, free dental checkups for people, because we want people to sit up and take notice. We want people to be aware that, listen, don't ignore this condition. Right. It is something that is very easy to take action on, especially in early days. Take care. That's our mission.
Well, that's a great job that you are doing. Thank you for sharing that with us. Let me go across to Dr. Laheji. We have been talking about the challenges. So my next question would be that despite the initiatives which have been taken up so far, supporting individuals in developing healthy oral habits, what have been the biggest challenges that we have been facing in ensuring dental access to the citizens?
The basic challenges, as you're asking me, see, with the changing trends, we have to face the challenges, and that's the need of the hour. Now, as we are considering the WHO studies, that 88% people will be suffering with dental problems, and 75% people in India suffer with dental decay. Apart from these challenges of dental decay as well as the gum diseases, there are challenges to accept in the form of precancerous and cancerous conditions. Considering the number of cases which we see here in India due to our habits like cigarette smoking, cigar, gutka, pan eating, then in the form of e-cigarette and also hookah, pen hookah, there are challenges we have to face. This is because there are many conditions where we see not only the pre-cancer and cancerous condition, but the metastasis from these two conditions may lead to other systemic problems if they are not treated in time. So this is the basic challenge our society is facing, and we have to follow different treatment and proper follow-up so that this can be stop at this stage only.
Well, absolutely. I couldn't agree with you more. But it's very interesting. And Dr. Tulika, I'd like to come to you on this aspect, that I've come to understand that nutrition plays a very important role as well in our oral health. So what, as per you, is the importance of a balanced diet to ensure we have oral health?
As you rightly said, nutrition and oral health, these two are, I would say, they are bidirectional. Because if you have proper nutrition, you're bound to have a good oral health. And why we say that is, if we go back to the intrauterine life, the tooth itself starts forming in the 6th week of intrauterine life. So the importance of nutrition starts from there, that we need to have a proper formation and development of the tooth. And as you all know that, we all keep saying that have milk, we tell the children. So calcium, phosphorus, vitamin D, these are all essential, and other minerals, these are all essential nutrients which are required, and a balanced diet is going to incorporate your all these minerals along with proteins, and certainly a fibrous diet, because that will also help in reducing the amount of cavity or the dental caries and the periodontal disease. So if we have a balanced diet, a good nutrition, certainly we would have a better immune system, and that would in turn help to have a good oral health.
Well, we are going to be slipping into a short break, but don't go anywhere. We are going to be right back. After a short break, we will be discussing the oral healthcare barriers as well on the other side. Stay tuned. Well, welcome back to our show. Niva Bupa Health Insurance presents Times Network Living Room Conclave, India Health Mission Season 3, co-presented by Sensodyne, where we have been in a conversation with our panelists on Be Sensitive to Oral Healthcare. I'm going to come to you now, Dr. Kohli. I'd like to get back and understand how dentistry has evolved over the years in India. Do you believe that there is a need to change the outlook towards dentistry, that most of the people proactively approach dentists for keeping their health in check?
That's a very good question you have raised. And let me give you a little background about the dentistry. We have progressed a long way from 47, now in 75 years, we have gone a long way. But if you look back, in the developing countries, the dental disease is a big problem. Like, take the population of the world, it's 7.8 billion. And now we look into it, 3.5 billion people suffer from one form of the dental disease or the other form of the dental disease. That means out of 100%, like 45% people have the dental diseases, and it is more common in the developing countries. And out of the 4, 3 people have either the gum problem or the decay problem or the missing teeth. All these issues are there. Now coming to the point, why people don't reach to the dentist for the treatment or other things. Like, very honestly, if you ask me, dental health never used to be the first priority for any person. Like if it's a heart disease, one runs to the doctor. If he has an eye problem, you run to the doctor. But when it comes to the teeth, person keep on delaying it. But most of the dental diseases are preventable. And another thing in dentistry, if something is lost, it has to be repaired or to be replaced by the dentist. It doesn't have the self-repair. So it is more important than the other thing like dentistry. And coming to the point why people cannot reach, because we do not have the insurance in our country. So that's another part. And if you look at the developed countries and the Europe and America, everybody goes to the dentist. How many people use the toothbrush? How many people go to the regular checkup for the dentist? And the last and not the least, most of the dental colleges and the dental services are in the private sector. And the cost economics also comes into play when it comes to. So in need of the hour, if you ask me, the country should look into to provide the dental insurance to the common man so that he can reach and avail these services. And as far as our country and dentistry profession, dentist education, we have gone a long way, and there is still a more room for improvement.
But it's important for us to understand, and I'll come across to you, Dr. Laheji, what really is the need of the hour, especially when it comes to the entire health infrastructure?
We need to increase our infrastructure as far as the oral health is concerned, because see, if you will see that most of the dental professionals are located in the larger cities, but in the rural areas there are only, I think, 10% people who are serving the communities. So here we have to take a stand and make the people realize that fundamentally it is important to recognize that the oral health is related with the general health. Absolutely. People should have healthy teeth and a brighter smile. So for that we need to implement certain oral health policies. We need to implement them so that the society will get benefited. It should be beneficial both for the dental professionals as well as the communities. So in that case, what we need is to have different programs. Like some time back, we had a program by Indian Dental Association for the National School Health Program, a school oral health program. A workshop was carried out so that the importance of this should be told to the volunteers, and they go at different places, not only in the cities but in the rural areas, and give them the importance so that they will realize. And there should be more units, dental health
Absolutely.
Units, public health departments in most of the areas where people will learn, and they should be services should be reachable and affordable.
Absolutely.
So that each one can afford and go for the treatment.
You're absolutely right. This public as well as private health infrastructure, we need to bring the two together so that they can work together. In that case, Anurita, it's been about 13 years that Sensodyne has been associated with the mission of sensitizing people towards oral health. So through what all ways have you attempted to break through this oral healthcare barriers of India?
I think the journey started, as you rightly said, 13 years ago when Sensodyne entered India. We take huge responsibility, as I said earlier, to drive overall oral health awareness, and specifically to make sure that the journey starts with consumer education. Absolutely. We consider it our responsibility to make people aware of the condition, in this particular case of tooth sensitivity, and we take no short measures to be driving that particular mission. Consistently, in partnership with dentists, as well as through simple advertising and other means, we are building awareness of the fact that this is a serious condition. That when you feel any limitation in having cold water, in having hot tea, and there is a certain sensation in your teeth, we've coined a local word which I'm sure that you would have heard of, which is jhanjhanahat. And vernacularly also, whatever the word that is used by different parts of this country, and we are a multilingual country, we have attempted to talk in the same language to the consumers, because again, it goes back to just making people aware of this condition.
Simple, small steps go a long way, don't they? In that case, Dr. Tulika, what as per you are some of the common oral care conditions which have been observed in the patients these days? Do you think there is any correlation of oral health to the underlying health issues that one can be having as well, and we can take preventive measures for?
Basically, any disease means that there is a presence of microorganisms.
Right.
And when we talk of oral disease, means these microorganisms are present in the oral cavity, leading to the deterioration of the oral health. So, as it is the first point of contact of the whatever we eat, and then it goes in the entire body. So, one of the research work has said that even any kind of a disease in the oral cavity, whether namely a periodontal disease, that means a gum disease where you have accumulation of microorganisms, that may lead to cardiovascular disease. So these are both related, and certainly if we want to reduce the chances, we need to maintain a good oral hygiene.
A quick word, final word I'd like from Anurita also before we let you go. So we've recognized that consumer education is of course very crucial when it comes to oral health. What are your thoughts on putting more emphasis on those who champion the overall architecture of it, essentially the Indian dentists?
I think for us, the dentists are the key stakeholders who are here to take care of the oral health of Indians. For us, it is an important day on World Dentist Day to recognize the role that they play in people's lives. Just like I mentioned earlier, where people take oral health for granted, we strongly feel that it is time for us to stand up and salute the role that the dentist plays in our lives as well. For us, they are the harbingers of joy. They bring back the smile on the face of people. They are the reason why people who have any kind of, severe, in this particular case, tooth problems, any kind of severe oral health conditions, that's when they remember the dentist.
Absolutely.
But you know what? The dentist comes to play even then, and make sure that whatever treatment is needed is taken care of. We are encouraging people to reach their dentist earlier, when the problem is not bad enough. So thank you to the dentists who are selflessly contributing to the oral health and therefore the health of this nation.
So that's very interesting. So it seems that what's behind that healthy smile is going to be the key to a very healthy lifestyle as well. Well, that has been a very informative perspective on why we should be paying more attention to those sensitized teeth of ours. In fact, it's easier to disregard the nitty-gritties in our frantic lifestyle, but the long-term cost is just way too expensive. I'm sure the first thing most of us are going to be doing after hearing these truth bombs, if we can call it that, is to schedule an appointment with our dentist. I'm not sure about you, but that's exactly what I'm going to be doing after this episode. So that's it from us here. Thank you so much for watching.